Now, in communicating with our care team, we want to use those same strategies for communication that we just reviewed about communicating with our loved ones and communicating with our support network. We want to maintain an assertive style of communication, even when we're in the presence of professionals. Behind the badge, behind the name tag, we are all people as well, and we all deserve the equal chance and opportunity to be heard and should be perceived as equals when we're together, even if it is for the sake of making some important decisions about one's care or treatment. One of the things we want to do is respect our loved ones' wishes, again, and what their wants and needs are. By discussing those with our care receiver or loved one, even prior to the appointment, get an idea in advance as to what they might want, what their values are, so that way it can help guide the discussion and guide some of the questions around some of those decisions, and as well as just being able to come prepared with decisions regarding treatment and certain other important aspects of their care. Okay. We'll want to initiate conversations with our care team, such as discussions regarding goals of care and why those goals are important to the person we're caring for. Again, we want to take into account their spiritual and religious considerations and what it means and what quality of life means to them. And what is quality of life? Quality of life is any part or aspect of someone's life that gives them any sense of quality. So again, what is important to them? Is it, or is it important that they are pain-free? Is it important that they have the opportunity to participate in something? What do they value? What do they cherish? And what are their hopes going forward? And what are they hoping to get out of their experience? Again, it's important to involve them in the communication process and these discussions where and when possible. It's important that they get the opportunity to speak when and where able, and again that our physicians and our other members of our care team are speaking directly with our care receiver. You'll see sometimes in a hospital room, the doctor might come in and immediately start talking with the family member who's sitting at the bedside without acknowledging the person who's actually there receiving care because of their own preconceived ideas of whether that person is even capable of understanding that information. So it's important that we really take an opportunity to communicate directly with the person who's receiving that care and to really gauge their understanding so that we can effectively coordinate that treatment and honor what their wishes are. What you'll want to come prepared to these appointments by working with your point person to identify important questions, different things that you might want to ask, and to take the opportunity to ask those when you're there by initiating those conversations again and by requesting that you have that opportunity. It's important that you take notes and remember that there is no stupid question. Any question is on the table, and it is important that we ask all of the questions we come prepared with, or at least seek to have those questions answered after the fact if anything is missed. As a caregiver, one of the advantages that you have is that you know your care receiver or your loved one best. In fact, far better than we know them. So we rely on our caregivers to give us information about what that person's baseline is or any other medical issues or challenges that they may have experienced or been facing. That way we can identify patterns to their health challenges or just more or less create a better sense of awareness and give us that full picture as to what challenges they might be facing at home, as well as what some of the challenges in providing them with good care are. Of course, it's important that you know your rights. Everyone has the right to access their own medical or personal health information, to get copies of their medical records if they feel they'd like to have a look at them themselves. We encourage people to seek out a second opinion if they feel it's what they need or what they need to gain that reassurance that they're getting the best possible care they can have. We have patient advocates that work within our hospital to help advocate on behalf of our patients where they don't feel they're able, to make sure that, again, their wishes are being honored and that all of that information is being shared with them and that they are getting access to every option possible. too often do we see, or do I hear of patients who are hesitant to ask about a second opinion in fear of offending their physician, when in fact that's not the case. Most of our physicians, especially here within our cancer center, encourage others to seek out second opinions and want them to do so that, again, they feel confident in the care that they're getting and that they're receiving, and know that they're getting the best possible treatment that's out there.